Would you take your seats, please? Take your seats, please, for the panel on awareness and education. So we've got a really good group of people here today to talk about outreach, what we can actually do in terms of education and awareness. And I'm going to briefly introduce everyone, and then they'll talk for a few minutes, up to 5 minutes, to present some thoughts about in this area and a little bit about what they're doing. Then we'll have a discussion among the panel and then invite you in the audience, and we'll pass 2 mics as in the previous session. So down on the extreme right there is Phyllis Bedford, and she runs the LymeLight Foundation, which is an amazing organization that has been awarding grants to hundreds of people who have no other way of supporting treatment for Lyme disease, and she's been doing a great job. Next to her, we have Scott Brandon, and he's at the Open Medicine Institute. And his specialty, and he thinks about how to create energy around gaining sort of increased exposure and enthusiasm about changing people's attitudes towards things and harnessing resources. So that's an important element of this. Next to Scott is Linda Giampa, who's the head of the Bay Area Lyme Foundation, which is an amazing organization that has been doing a lot of awarding for research and also outreach to both patients and potential patients and to clinicians as well. Next to Linda is Annemarie Hersh, and she's at Geisinger and really understands what's happening about with physicians and their interactions with patients or at-risk patients, and also some environmental factors and such. She'll be talking a little bit about that. And here next to me is Nevena Zubcevic, and she's at Harvard Medical School and is an expert in chronic traumatic encephalopathy, and was drawn to look at those who are really affected by Lyme's disease chronically, and looking at the medicine associated with that and what the needs of those people are. So we'll start down with Phyllis, and maybe she could talk for a few moments and then pass.
Okay, hello everybody, good morning. I'm Phyllis Bedford, and I'm a founder of LymeLight Foundation, and I'm currently serving as the development director. And it's an honor to be here with all of you. And I really want to thank Mount Sinai and also the Stephen and Alexandra Cohen Foundation for bringing all of us together. LymeLight Foundation was founded in 2011 by 2 families who both had daughters suffering with Lyme disease. Grateful for the financial means to provide our daughters life-saving medical treatment not covered by insurance. We met many parents who are forced to decide between feeding and housing their families and treating their Lyme-infected children. LymeLight Foundation was founded on the belief that this is a choice no parent should have to make. LymeLight Foundation provides grants up to $10,000 for children and young adults through age 25, whose families cannot pay for the necessary medications and therapies. Applicants must meet our grant eligibility standards and requirements. Once these are met, financial need is the key driving force for grant selection. Currently, we are only able to touch those in the most dire situations. During our first year, as the slide shows, in 2011, we awarded 40,000 treatment grants. This year, 5 years later, we are on track to award 775,000 in treatment grants. Since inception, we have awarded over 1.9 million in grants to individuals in 41 states. We couldn't have achieved this without the partnership of a few key donors. And again, I want to highlight the Stephen and Alexandra Cohen Foundation for being one of these key donors. Their support goes directly to program, which gives all these children the chance for a healthy future. The second part of our mission is raising Lyme awareness. We take a grassroots approach to raising awareness. Along with our targeted awareness events, we view every fundraising event as an awareness opportunity. For example, every August we host a Lyme awareness and tick safety tent at our Right for Lyme event. We find we use an interactive game which draws people into our tent. This starts the conversation. We are always amazed at the lack of Lyme awareness. We are equally amazed, but have come to expect the stories, the high number of stories of family and friends who share that they have relatives that are extremely sick, misdiagnosed for years, but have finally received the Lyme diagnosis. An area of the foundation that is growing exponentially is what we call auxiliary fundraising and events, where others use our foundation materials across the nation to build awareness. Our most famous auxiliary fundraiser to date is by pop singing sensation Avril Lavigne and her birthday foundation's campaign. Little did we know when we saw her on the cover of People magazine that a few months later she would be fundraising and raising awareness on our behalf. Other auxiliary events have included a music night, hiking the Colorado Trail, an ultra marathon who is chasing a world record. And by providing these educational materials to these people, we are spreading, as I mentioned, Lyme awareness across the nation. And this has just started. These are people that are approaching us and are asking us who have been touched by Lyme in some way, and are saying, what can we do? And so, as I said, these events can be small or big, but they are having a huge impact. Currently, there have been 18 states that have hosted auxiliary events, and as I said, this is just beginning. I now want to introduce you to Brady and Andrew. I believe their story illustrates the full impact of LymeLight Foundation. Their dad is a California Highway Patrol who stopped by our awareness tent at our Ride for Lyme event. He recognized the Lyme symptoms we highlighted as those his family had been suffering from for years, but that no doctor could diagnose. We gave him information about how to get tested, and indeed, both his wife and their 2 children tested positive. They then, because they didn't have the funding, applied for a treatment grant, and both their children were awarded one, enabling them to get treatment underway. The best news is that these children, along with others, are getting better, and that these grants are making a huge difference in their lives. We feel a big piece of solving the current Lyme epidemic is getting people sick that are sick now well, so they become part of the solution. We received incredible feedback from those whom we have helped that they are motivated to become involved. We have children telling us they want to go into Lyme research. They want to go into the practice of medicine or become a Lyme advocate. We feel this is extremely impactful and that these people will become the educators of tomorrow. Thank you.
Thank you. Scott? Scott?
Great. Hello, everyone. My name is Scott Brandon, and as mentioned, a little bit about myself. Before I'm originally from New York. I lived here for 30 years. I was director of education at Lincoln Center for 25 years, and during that time, I like to boast that we raised hundreds of millions of dollars for education. We grew the organization nationally. In fact, it was replicated 28 times around the world. And we established world-class efficacy-based programs based on a term called aesthetic education. And I mention aesthetic education because John Dewey, the noted educational philosopher, was once asked, what's the difference, what is an aesthetic education? And his answer was something that I found quite fascinating. It's the difference between an aesthetic and an anesthetic education. An education that awakens you, brings you alive, as compared to an education that deadens you or numbs you. So the goal was, how do you create an educational structure, an image-based educational structure that brings people, helps them wake up, helps them want to look, helps them want to see. It's something that I've brought into the work that I do today, both as a consultant and in conjunction with the Open Medicine Institute. Dr. Kogelnick, as we look at how you bring together the work of the amazing work that's already been talked about this morning around research, medicine, clinicians, physicians, but also bringing together that other part of the conversation, which I congratulate you for bringing today, which is the education and awareness side. They both are absolutely dependent upon each other. I like to joke that they let me out after 25 years for good behavior at Lincoln Center. So today I'm not going to talk specifically about Lyme as an illness or a disease because admittedly I don't know much about it. I'm probably the only one in the room who can make that statement, that I truly don't know much about it. But I will speak about and hopefully be able to answer questions about perception, imagination, and the actions within this massive arena of education and awareness. Think precision education meets big data toward addressing the chronic symptoms of invisible awareness. Precision education meets big data toward addressing the chronic symptoms of invisible awareness. So if I had a slide, that would be my first slide. We keep talking about mice today. I keep hearing about mice, and I'm fascinated by it. I feel a little bit like a mouse at the moment, that I'm not sure what I'm doing here, but I think I have an important role to play. So I want to thank you once again for including me. So as I mentioned, I'm here representing Dr. Kogelnick and the Open Medicine Institute and the nonprofit organization that I'm starting with and through the help of Dr. Kogelnick, where we're going to focus the light on spotlight off, lantern on. You heard earlier about Plato's cave. It's about creating images. It's about creating the ability to see things that normally we don't see. Cezanne said, your eyes see the front of a painting, imagination curves to the other side. I'm interested in what we see around the corner, not just what we see in front of us. How do we create that image-based lens toward perception, toward growth? And how do we change the stakes of what we're talking about from a low stakes argument to a high stakes argument? If I had a slide, my second slide would be chess boxing. Has anybody ever heard of chess boxing? There's actually a sport where you box for 2 or 3 minutes, then you play chess for 2 or 3 minutes. You box and then you play chess. You can win either way. What I love about it is, as a metaphor, as an image, it's the marriage or the bringing together of strategy and strength. Not just one versus the other, but both as necessary conditions. So what I'd like to leave today and hopefully talk about more is how do we bring this work to bear into the conversation around Lyme disease, around precision medicine. What interests me is what I've grown to term imagination conversations, public civic dialogues that bring cross-sectoral conversations around the importance of not just the research and medicine around Lyme or chronic illnesses, but how we get the public and the clinicians and the patients to pay attention to the terms and conditions, the ideas that you're going to hear about from people who know and are doing work a lot deeper than I am. I'd like to do one quick shout out to the Project Lyme and the amazing work I believe they're doing around prevention and related topics. So I want to thank them for the cogent work they're doing. Thank you.
Thank you.
Okay, now for something entirely different. Hi, I'm Linda Giampa from the Bay Area Lyme Foundation, and our mission is to make Lyme disease easy to diagnose and simple to cure. Everyone in this room should understand why that has been such a difficult mission, but we are focused on that. We fund research in therapeutics, diagnostics, ecology projects, and biobank. And I have a map as well, Phyllis. So the map in the middle is there because the heart of everything that we do is surrounded around research and finding a cure for Lyme disease. We have 26 projects going on throughout the United States right now. We have several people in the audience that are fundees, and I'm going to go ahead and start on the research project up at the left-hand side. So one of the projects that we're doing around bringing new researchers into the field of Lyme is called an Emerging Leader Award. Maybe some of you have heard of it. We started it in 2014, and it was a $100,000 award to postdocs for doing work in the field of Lyme. The idea behind the Emerging Leader Award was to bring everybody into that was not in the field of Lyme and to attract them into the field of Lyme because we need new and better researchers into the field of Lyme. Lisa Blum is here today, who was our 2014 winner and has continued to be funded by us. Second thing that we have done recently in the same vein to bring researchers in is a hackathon. Nev is well aware and might talk about the hackathon today. Andy Kolganek was involved. Bay Area Lyme Foundation sponsored that event and helped to put it on and was intimately involved. And that's even younger people to bring people into the field of Lyme. And I'm happy to talk about that. Third is opening up these precious resources, which are created a biobank a couple years ago. We're in our second year. Happy to say that the Cohen Foundation helped us to really bring this out to the world. We have collection centers in Martha's Vineyard, New York, Wisconsin, and getting ready to sign with a group in California. And all of that is around bringing new researchers into the field of Lyme. We also announced in February a free tick test study. It's a nationwide free tick testing, and originally this is with Dr. Nate Nieto in Arizona. And when we scoped out the project, we thought, well, if we get 500 to 700 ticks, we're doing really well. I guess my marketing plan did better than we thought. We received over 6,000 ticks from 49 states. Shows you the breadth of the problem that we're having. This is a multi-year project that we have decided to do, and at the beginning of next year we will be publishing a heat map of all the results of those 7,000 ticks that were done and making the public aware of that. One of the other things that we're working on right now down at the bottom right of the screen with patients and physicians, I call it a grassroots effort as well. I call it Could It Be Lyme? Could it be Lyme to put pamphlets in that's the goal, every physician's office as possible to say, okay, these are the symptoms of Lyme. You're going in, you have, chronic fatigue or pain or brain fog or whatever it is. Could it be Lyme? And arm those patients, create advocates out of those patients to go in and really push their doctors to say, look, this is what I read, this is what I think I have. I don't remember being bitten by a tick. I might not have had a bullseye, but I want to tell you that I think this is what it is. So that's a grassroots effort that we're doing, that we're trying around. Also, when we talk about, I was asked by Greg to ask about, okay, the lofty goals. One of the lofty goals that we have, and this is something that is very near and dear to our president, is creating a treatment for acute Lyme patients based on a consensus symposium, group that says, okay, what is the treatment that everyone across America, maybe the world, would do with an acute Lyme patient? So that's my lofty goal. And then moving over to public health, we do a tremendous amount of outreach. I don't have time to talk about it, but we have worked with the National Association of Outdoor Environmental Enthusiasts, and we are training the trainers. So those are all around the country. We have trained over 200,000 children through this leveraged program of training the trainers. We also are working with the National Park Service. This year was the 100-year anniversary of the national parks, and we did a big outreach on that. And if any of you rode on American Airlines or United Airlines in February and March of this year. You might have seen our PSA. That was a pilot project that we did on American Airlines, and that told people all about, could it be Lyme, and this is what you have to look out for, and it's a national epidemic. So that's something that we might look into to do on Virgin and JetBlue. And then finally, I brought some, because I like to do this, show and tell. These right here, if anyone wants to come up, are signs that we're hoping to get out to all of these cost $10 a piece, and we're hoping to get these signs out to all of the NEOE group that I was talking about. We've done 200 so far in California, and our goal for this is to get this out to every outdoor educator place and post them up for all of the children that are going to these field trips, and teaches them how to check for ticks, because we're all about prevention. And then last but not least is my tick wheel. My tick wheel lofty goal is to get this. This is a prototype for us. Costs $65 a view, and we want to get this into all of the elementary schools across the country, in all the science fairs, the science classrooms, so that we can teach children at a young age how to look for ticks, what to do if they find a tick, how to remove ticks, how to go home and tell their parents about the ticks. And this would be something fun for them to do in the elementary schools. So there's my 5 minutes, and thank you very much.
Thank you. Dr. Hirsh?
Hi, everyone. My name is Annemarie Hersh. I'm an epidemiologist at Geisinger Health System, which is located in Danville, Pennsylvania. And we're working with Johns Hopkins University to study Lyme disease in Pennsylvania with funding from the Cohen Foundation. So Pennsylvania has one of the highest reported Lyme disease infections in the country. And Geisinger has a tremendous amount of data on a large portion of these patients. Geisinger covers about 32 counties in the state of Pennsylvania. And in our electronic health record, we've found 17,000 patients who have a diagnosis of Lyme disease. And we know garbage in, garbage out, and so we know that we can look beyond diagnoses in our patient population and look at the clinical notes and labs and medications to really get a good picture of Lyme disease in the population we cover. Our data goes back to 2001, so on a lot of these patients we can tell you what was going on before the diagnosis, and we can look at the difference between kind of first symptom presentation to when they got diagnosed. And we can look after diagnosis, in many cases for years after diagnosis, to get a picture about what's happening after. At Geisinger, we also do a lot with environment. So we have geocoded everybody, and we know a lot about where they live. We know that Lyme is endemic to Pennsylvania, but we don't know if there are certain factors, forestation, green space, land development, land use, that might put people at an increased risk. And we're able to look at that as well. And in addition, we're doing, with funding from the Cohen Foundation, we're doing some patient-reported data collection. Thank you. We're doing all of this to get a better picture of Lyme disease risk. When we talk about risk, we're talking about more than just risk of getting Lyme disease. Something that's a bit understudied is, among those who have Lyme disease, who's at that risk of not getting diagnosed in a timely manner? Does it have something to do with the way the symptoms are presenting? Is it their sex? Is it their race? Is it their health insurance? Is it the language they're speaking in their home? And we want to look at all these social, environmental, and clinical factors to see if we can find out who's at risk for these delays. And then finally, who's at risk for these long-term outcomes. And this is an education panel, and so when thinking about education, I'm going to borrow a term that Scott used. We can use this data to do some precision education. We can use this data to determine who's at risk at each of these levels and target them with educational materials. And coming from a health system, we're looking at how we can do that within the context of healthcare so that we can educate those most at risk and those treating people most at risk. Geisinger and health systems around the country do this for a lot of other diseases, but Lyme has lagged behind. So, for example, when I take my 3-year-old to the doctor, he's a butterball. He's been a butterball since birth, chubby cheeks, chubby thighs. And so when I take him in, based on his age and his sex and his weight and his height, the doctor gets a little note that says you need to talk to this mother about sugar-sweetened beverages. I don't do that, but sugar-sweetened beverages and food and exercise. And it's an opportunity for education that happens in routine clinical care. This needs to happen with Lyme disease. When I take my 6-year-old boy to the doctors in the summer, when Lyme disease risk is high, and based on his age and his sex, he's at an increased risk of Lyme disease, shouldn't the doctor also get a note to say, talk to this mother about some of the things that Linda was talking about that I could do to make sure he's protecting himself? And in terms of delays in diagnosis, couldn't we also have that doctor say, well, based on his age and his sex, the earliest symptoms will likely be A, B, and C, so if you see them, make sure you come and see a doctor. Similarly, if we can identify those people who are at risk of not getting diagnosed in a timely manner, with the technology that we have now in health systems, we can build in algorithms that if the doctor puts in symptom X, Y, Z, and that's at a person who's at risk of a delayed diagnosis, perhaps a message comes up that says, have you considered Lyme? And so with the epidemiological research that we're doing right now between Geisinger and Hopkins, we hope to inform precision education at the health system level and bring Lyme disease to the table next to obesity and these other diseases in our health system's efforts to promote health and prevent disease. Thank you.
Thank you very much. And great. And Dr. Zubcevic.
Hi, everybody. It's nice to be in this room. It feels like a family. Most of you I know, and I see some of my patients are here, and a lot of longtime collaborators. So it's really cool. Big thanks to Mount Sinai. I spent part of my medical education here as a medical student, so it's nice to be back as well. But to the Cohen Foundation, to helping bring us all together. The more we're together, the better, and hopefully as new blood comes in, we'll even be stronger and be able to deliver more. So I'm a doc in the trenches. I come from a background of brain injury research and from the largest standalone rehab hospital in New England, and Spalding has really pioneered a lot of great things and much research and improvements in clinical care for many populations, including spinal cord injury, brain injury, pediatric rehab, and so forth. And we noticed that Lyme patients were really kind of behind on that, and they presented very similar to brain injury patients, to our brain injury population, with their symptoms and this centrally driven, multi-complex, multi-system presentation. So we really felt that we should fill the gap, and we started the Dean Center for Tick-Borne Illness, and we're able to now serve the field a little better. So we basically designed a translational approach to care. So most of my colleagues here are working from kind of bottom up, so basic science research. We're working top down. And that's probably the biggest difference. And hopefully we get to meet in the middle. So we're first, what we did is we listened to patients. So we started with many patient support groups in the area, and we listened to them and tried to understand what their needs are. Then we had scientific conferences. I know I've talked to many of you, and many of you were kind to show up at those, and you know, especially Dr. Fallon there was our first keynote speaker in 2013, which was really exciting to accept the offer at Mass General, and it was our first Harvard conference on Lyme disease that was open to everybody. And then we proceeded with more understanding of the scientific platforms and who is doing who, and I know Dr. Baumgarth was there as well. And it was really nice to learn from the scientists who've been in the field for a long time of what the situation is and where we need to go. And then we designed our center and opened the doors in 2015. And since then have been collecting an incredibly large longitudinal data set on chronically sick patients patients with tick-borne disease. And I say tick-borne and not just Lyme because this is very complex and messy. And I work with that mess every day trying to decipher it and understand it. I don't have the privilege of just working with Lyme disease. I wish that I did. My job would be a lot simpler. But I also work with mycoplasma, Bartonella, and many other co-infections. Rocky Mountain spotted fever. Recently had a few patients with West Nile virus and so forth. So it's a very complex process to building a precision medicine model. And we've been working with the White House Office of Science and Technology Policy and recently with the VA innovation team to really understand how to best approach a very messy vector-borne illness platform and help our patients decipher through the mess, understand their symptoms, then we've designed a lab that utilizes all the most modern clinical and research labs. So we utilize Galaxy for Bartonella. I talk to Ed Breitschwartz more than he wants, probably once a week, trying to understand my patient's data because Bartonella is a huge culprit that we find in conjunction with Lyme. We find many strains of Lyme. Frequently, my patients I diagnose with Borrelia hermsii, Borrelia miyamotoi, or they're just positive on the C6 peptide. Recently, we've been utilizing Ceres nanotechnology. We're working on a couple of studies. I believe that some of the foundations have our proposals on your desks, so we'll hope you will review to understand actual direct detection antigen testing for Lyme, because that's been very valuable in our chronically sick patients. And when we're able to find an actual urine antigen, it really changes the course of treatment and insurance coverage for our patients. We also do anti-neuronal antibody platforms, working with Madeline Cunningham and the molecular panel to better understand the anti-neuronal impact on our patients' brains. We do a lot of brain scanning also of our patients, so we're utilizing PET scanning technologies to evaluate the FDG PET and metabolism of the brain, which is delivering some very interesting patterns, whether it's Lyme or Bartonella or what co-infections are present or an autoimmune encephalopathy. And then we also do other kinds of testing. So we have a neurooptometrist on board, and we frequently find cranial neuropathies. And when patients are treated with rehabilitation tools to help improve that in conjunction, we are able to deliver better results. So it's a very comprehensive precision medicine platform, bench to bedside, top to bottom kind of approach, and that's what we're doing at the Dean Center. Thank you.
Thank you. So in talking about education and outreach and these sorts of things, it seems to me that there are a number of realms that all of you have touched upon in one way or another, but there's the public and education of the public. There's education of physicians, because people often don't get very good care even if they kind of know what's going on. And then there's outreach towards the physician population or towards researchers to try and increase the kind of quality or the understandings that are available. Do you have any sense, and why don't we start with you, Dr. Hirsh, in terms of the relative opportunities that are represented in these different realms? In other words, it's a lot of effort to do something that would move the needle relatively quickly because the whole medical environment is changing significantly. Which of these, three areas do you think would be most useful focus?
Well, I'm going to be biased because I'm in the health system. And so the positives of the health systems is that we can, with the technology we have now, deliver information at point of care to both the doctor and the patient. But I think an argument can be made that not everybody touches the health system in the same way, with the same frequency. And so while I think it can move things tremendously, I think that what some of the other people are doing to reach the general public is incredibly important, because there will be people who will be missed who do not maybe get in for the same number of physicals or appointments. And so I think it's a good way to reach doctors and patients, but I think we have to move beyond that, of course, too, and make sure we're reaching everybody at risk.
Well, you've certainly reached out more broadly, Linda. What are your thoughts about that?
My thoughts are that we really have to in the lofty goal, reach out to everyone. We focus on research, and so one of the things that I didn't mention a couple of minutes ago is that in 2017, we're broadening our what we call Emerging Leader Award to include higher level associate professor and above, with a $250,000 Alex Cohen Award. And that will be, next year, presented next year sometime. But for us, for prevention, we really go after the young children. Our idea is that we don't want anyone else. The easiest way to prevent Lyme disease is to let everybody know to prevent. It's so much easier to take care of it in the early stage or before than it is later and chronic. And so our idea is to go after elementary and middle school children in a very direct way.
Any thoughts, anyone, about the relative balance between chronic disease, where there are individuals who are clearly not being treated very well or effectively within the system, or at various stages after infection? There are a lot of infections each year, versus prevention. Is there a distinct, in anyone's view, should there be an emphasis? I mean, you have spoken about that, Nevena, I think, about the issue of the chronic patient and their needs aren't being met very effectively.
I mean, we're so behind any other chronic illness, and it's really, learning from what people have done in the past with other chronic illnesses and how they've tackled, and especially I think, people have really established good approaches to, say, HIV or cancer, and learning from them on how to approach this is probably key for the Lyme community at this point, and helping disenfranchised patients get better treatments, resources.
And Phyllis, you have dealt with more patients that are not being well served by the current medical system. What are your thoughts in all those stories?
So here's my thoughts. We get applications after applications, and we wish we could help all these young people. But the stories can almost always be the same. We saw 10 doctors, we saw 12 doctors, we saw 25 doctors, and they are not getting diagnosed. And this is throughout the whole nation. The West is a bit behind because this is, Lyme is a Northeast disease. But it's just amazing, truly a lack of awareness across our whole nation is amazing. And I also did a brochure, what everyone should know about Lyme disease. And we post this everywhere too. And part of what I was saying to someone in the audience is using our voice, all of us. I mean, my husband jokes that I'm in a party talking almost always about Lyme disease. I feel like we all need to be advocates. We all know what is going on, and we all can help people get diagnosed. But these families, here's the tragedy too. These families get diagnosed, have a child or children. Lyme does tend to run in families. And you get this diagnosis, and then your insurance doesn't cover treatment. You finally have a diagnosis, but you can't get treatment for your child. I mean, that's a tragedy, and that's in our country. I mean, it's just astounding. I mean, I could go on and on and on and on about, literally we talk about at our board meetings how can we help more? How can we just fundraise to get more of these children helped? And these are just the children. Then we get the calls from the adults. Why are you only helping children? What's wrong? And we say our biggest hope is that there'll be another foundation that is started that can target the adults out there. And we have to actually be prepared in crisis management, because we also get calls that I'm going to commit suicide. I'm in so much pain I can't go on. It's a big, big problem. So anyway, I'm sure I've gone over my time, but I just have to say it's much larger and affecting so many more people than we realize.
So if I may, So in Massachusetts, we had a grassroots movement by the patients who went to the legislators and said, we're really sick, and these specific treatments have helped us, and mainly, patients haven't had like IVIG covered or long-term antibiotics covered, and patients who've been helped by these came and testified, and now it's written into the law that, insurance is, if it's physician prescribed, it needs to be covered so that the insurance companies aren't the ones making the decision of how medicine should be practiced. And so the legislators voted for that. So, which makes sense, right? For any disease that we're still trying to figure out what the causes are, especially something as complex as tick-borne illness, the physician really should be the person, together with the patient, making a decision of what they should be trying to help their patient. So I think that one of the solutions is to help educate, the NIH, the CDC, have more meetings, bring in the IDSA and the NIH and all these organizations to discuss and formulate better approaches, precision medicine driven, data driven, bring the data out in the open. That's why I'm working with Andy Kogelnick and the team to try to bring this data out, bring the messiness so that this is not simple to diagnose, it is not simple to cure, and we should be putting that out in the open and allowing physicians to have more meetings and discussions how to approach this better, and then the legislation will catch up, and the insurance companies ultimately need to catch up with that as well.
Does anybody else want to make a comment on that? And while we're doing that, if anybody has any questions in the audience to participate, they'll pass 2 mics around and we'll go back and forth with the audience in a moment. So keep your hands up and go ahead, whoever.
Just quickly, a few years ago, when I was at Lincoln Center, we did a series of workshops. We were invited by the pediatric physicians from North America, from the US and from Canada, do a series of workshops and lectures on releasing the imagination as a diagnostic tool for pediatric physicians. And the question was, how do you get physicians to start to look at things as if they could be otherwise? Once again, how do you get them to perceive deeply, to ask questions, to notice patterns, to make behavioral decisions based on not just what you think you see, but other elements that can be discerned from the interaction? And I think what's important about it is not just that it was the pediatric physicians inviting us into it, but in the same year, we did it for first responders. In the same year, we did it for the Department of Defense. The point is that we have to keep not just researching, we have to research what it is we've already looked at. We have to keep changing the perception to find new possibilities. And it's through that discussion, I believe, that the public awareness will come.
Okay.
I have to bring up the topic of the university system and education being displayed to them in some type of manner where it'll infiltrate the systems, where students are able to get credits and get a bachelor's degree while being ill. I think it's so important that there is this education being given to early childhood educators for younger children. If that were the case 13 years ago, I may not have been in my position where I am now. But I feel like there's a point in student education systems where there's a drop-off of where people with Lyme disease, young adults, the front runners of this illness who got sick in the very beginning of the real, epidemic coming to fruition, are the front runners in trying to get bachelors in science and in arts and anything. And it's not possible for us to really do that and fight for life, fight for survival, be surviving, fight governments. And I find it ironic that somebody like myself sits here today and can comprehend what we're speaking about today. Like Nev was speaking about Dr. Zubcevic, I've been a patient of the Dean Center, spent this winter as an inpatient there, and it's been the best treatment I've gotten. Every day I spent in rehab, I can tell you, I got an education that you don't get from a book or a lecture or a classroom. So how can we get life credits where they're not just student credits, it's life credit where you can go somewhere and be somebody, I guess.
Anybody have thoughts on that? Anybody? Go ahead.
I'm so sorry because I don't know you, but I've heard your story so many times. I do not have the answer for life credits. I was hoping that Nev would join in for that type of thing for the older kids, but I do know we're working with the Common Core group for our younger kids so that they can get credits in their science group in the middle school in order to have credits around tick-borne diseases and provide a certificate to them and everything. But Nev, do you have anything to say about the upper grades?
Yes. Thank you for your comment, Chloe. My patient population, we have every age group, but the young adult is, a group that's specifically affected deeply because they're at that crossroad of, wanting to be independent, trying to live by themselves, finishing school and so forth. And it's always a rush for us to help everybody, but that special group, it's always very, I think, emotional in the sense that, I'm not that far along from being in that space, and I know how important it is in those crucial years for independence and growth and all the things you're supposed to do in your late teens and early 20s. And to help tackle that at the Dean Center, we're developing, and I shouldn't be really talking about it, but it's Carrie Ling, who's our mental health counselor, and this is her project that she's pioneering together with Andy Kogelnick and the support of many others to design something called a crisis text Lyme. And it's a platform, it's a free service, and young adults will be able to serve as counselors to help others. So both, your experience would be valued as somebody who's walked the walk, and also with some extra, additional training, be able to support others. In the sense of life credits, this is where experience would be most valuable, is to help somebody else and prevent them from having to walk the long path that you did, and hopefully get them to resources and treatment faster. So we're partnering with the Crisis Text Line, a well-established NGO for that, and also Open Medicine Institute to help execute that in the near future. And we're also applying for funding for that project as well. So to answer your question, but hopefully you'll be one of our counselors.
Thank you. A question there?
First of all, I'd like to thank you very much for everything that you're doing to help patients and children. It's really remarkable. And it's a shame that it took so many people getting sick before this happened. I was diagnosed with Lyme after having it for 10 years in 1992, finally. I have chronic disease. But what bothers me is that the ticks can be stopped dead in their tracks by the scientists who deal in tick research. They are the most ignored field of science. They have gotten the least amount of funding, and they hold the most promise to do things so that those children don't get infected in the first place. We had a 3-year-old child had 32 ticks removed from her body after visiting a local park when she had a bath that night, nymphal ticks. We had a 17-year-old boy drop dead after a month of illness, being diagnosed as just having a summer flu in a highly endemic area. He dropped dead after 1 month of illness. We had a woman who died of babesiosis, even though the family had asked the doctor to test her for it, but instead thought she had pneumonia. This has to stop. People shouldn't be getting sick in the first place, and we can do something about that. But those of you who have the funding, we need you to support the researchers who can stop the ticks dead in their tracks. Please, I implore you to do that. There's great ideas. There's great funding. Great ideas. I'd be glad to speak with any of you about some of the ideas and implore you to do something. And I'm wondering if you would be willing to do that.
Anybody have a specific comment on that, or? No.
That kind of falls under, under what we're doing, so if you want to talk about it after, that'd be great.
Okay.
I certainly would be happy to talk with you also to look at it as a prevention and education question.
Okay.
Let me come back.
Let me go just a moment, and we'll go to the back there, and then we'll come down to the front.
It's a question to Dr. Hirsh. It's very, really very heartwarming to see that Geisinger is getting into the Lyme arena, and at least we know as far as data collection and research, being such a closed HMO without the ability of members to go out of network, etc., and that's how most of our patients are getting treatment for Lyme. The question is whether Geisinger is doing anything as far as physicians' educations and getting on the treatment end and the diagnostic end of the problem, which is a little more liberal than what we see elsewhere.
Thanks for your comment. Just clarification, Geisinger is, you are correct, we are talking about our patient population, but we are more of an open system. The 30% of our patients have our health plan, and the rest can go elsewhere. And we have access to information that can help us understand where they're seeking care. But it's still a good point, and in terms of surveillance, that might not be Geisinger's strength. Instead, that's why we kind of really want to take a better look at what we can do about improving diagnosis and look at what factors increase your risk of such a delay, who's being believed, who's being listened to, and who's not, and use what we like to call our clinical laboratories. Our doctors are not always excited to see me when I walk through the door and ask them to try something new, but they're willing to do it and to try these new prompts, these have you thought about Lyme disease? And so we're going to build on our strengths in that way. You make a good point. Thanks.
One moment. Any thoughts about revisions to medical curricula, sort of CME, continuing credits? Because really the level of education in the broader physician population is quite low. And there are many experiences where people in the public are somewhat well informed, have a suspicion that is then allayed incorrectly by a visit to a primary care physician. That's certainly the situation that my wife had at one point, and had I not, explored it more deeply, it would have been a very serious problem. So, are there any comments about those? Are there initiatives, or have you been maybe?
So at our hackathon, that was a co-sponsored event. So we had Bayer Lyme Foundation as the titanium sponsor. Thank you, guys. And then it was together with the VA Center for Innovation and Harvard Medical School and Spalding Rehab. We were able to have several projects come out of that. One of them was a CME course. That would be an online course that physicians would have. And so we have about 6 physicians. One of them is pediatric infectious disease rheumatology. So we have pediatric ID from Children's, rheumatology from the Brigham, Christine Green, who's an ILAD doc from San Francisco. And so like a pretty diverse group of people who want to get together and design an online course that would be acceptable for either side and, vetted and scientifically based, and so forth. And so we need to do it. We need to find more time and funding. Again, it boils down to that to really be able to execute, but we do feel it's very strong, and we do have a team that's growing.
Okay, thanks. Go ahead.
Let me just comment on that. There is an online course done by Dr. Betty Maloney already.
I know that.
Okay,
I know that.
great.
Thank you.
Back to the issue with education and the problem with education, and I want to go back to your insurance bill. What people in this audience may not know is that bill was vetoed by the governor, and it was only through the effort of the people you were talking about to get the legislature to override the veto, and it was fought tooth and nail the entire time by the IDSA. So they don't want that education out there. They want their education out there. CMEs. The state of New York does not require you get CMEs. Did you know that? It's required by the Medical Society of the state of New York, not the state of New York. And they can teach whatever they want, and they fight any legislation that tries to bring the LymeLight's point of view into play. The CDC, on their website, lists only the now no longer listed on the National Guideline Clearinghouse IDSA guidelines. They do not list the ILAD guidelines, which met the Institute of Management. This is the reason education is so difficult out there. It's only the advocates, like the people on the stage as well as ourselves, who get broader education out there.
Okay. Is there another mic with somebody with a mic?
Hi. Hello.
Hi.
Hi. Okay, so
Go ahead, speak.
I want to pick up where this young lady left off, basically to say that I've seen this disease affect millennials, and it's really sad to not only watch many of these kids who have been forced to grow up with the disease, but to make them well enough to get to college and then see the process at college where they are discriminated against. There are no accommodations made for them, very little understanding of what they're experiencing. And, you know, these kids have been challenged and they're trying so hard to overcome it. And I think it's really critically important also that we recognize the environment that many of these students are being placed in, where I have actually seen students really who have been treated and are well enough to attend college only to become horrifically sick because their immune systems are compromised and they're placed in dormitories where there is black mold. And so I ask you all to please consider the importance of environmental factors as well in creating healthy environments for these kids so they can do the best that they are able to, and to help really do an outreach to universities for better understanding of the disease and accommodations to ensure that they can do their level best despite their own, illness. And I also want to mention that Global Lyme Alliance has put together a Young Leaders Council, and these are all millennials who have suffered with the disease, and they are essentially putting together a program to address colleges and universities all around the country. And I invite participation of young people, such as yourself, and other ideas that the group may have. Thank you.
Thank you. We're close to the end right now. Does anybody want to make a comment on those challenges that are?
One more question here from Chris.
Well, let's have a response, then we'll do the final question, and then we'll wrap it up. Okay?
We're over time.
Okay. Do you want to switch? Who?
Yeah, so this just builds on some of the previous comments about physician education. During the Cohen Foundation's last round of grant making, they actually reached out to the American Academy of Pediatrics and the American Academy of Family Physicians to try to provide them with resources to develop CMEs, ongoing education, and revamp their programming for physicians, and they were either unresponsive or upon thinking it through and debating it internally decided that they didn't want to take that funding to revamp their programs.
So it sounds like a very challenging path. I'm afraid that we don't have time for any further comments or questions because we're going to lunch now, but everybody will be there and be available at that time. Please.